Okay, so today's video is going to be basically over how to possibly alleviate a kinked neck from sleeping wrong or whatever, since most of us are probably going to be in bed a lot during this quarantine. So you'll only need two things: a butter knife and some kind of emollient. So I'm using my massage oil, obviously. You can use olive oil, lotion, anything that's really going to help the knife glide over your skin. So what I'm going to do is I'm just going to apply just a little bit of oil or cream or whatever just to my neck and probably my traps a little bit, my mid traps if you will. Really want to locate whichever side is most kinked up. You can do it to both sides. Obviously it's not going to hurt you or anything, but you obviously want to get into the side that's most kinked. So let's just say that my right side is kinked. I can't really turn my head to the right at all, hardly to the left. So what you're going to do is you're going to take the back side, not the rough side, but the back side, the smooth side of your butter knife. And you're just going to gently start with your head neutral, start right just at the base of your head, of your skull, and then just go back and forth very lightly, just up and down through that tissue. And you can kind of come into the trap a little bit. And you're just going to go up and down all through that tissue. Then what you can start to do is turn your head to the left and then to the right. Let that knife follow you as you move. So we're putting range of motion into this, technically I guess it would be considered instrument-assisted soft tissue mobilization. So we're just really trying to loosen up the fascia, which is the connective tissue, which creates restriction, and then we'll be passively, I guess you can say, affecting the muscle tissue. So we're freeing up everything that's restricted. You can switch hands and kind of go through that trap tissue also. What in this position you would want to try and touch your left ear to your left shoulder, so you're working away from the side that you're scraping, if you will. One thing to keep in mind though, when you're doing these types of things, especially with metal tools or anything like that, is you need to be working very light. You can kind of go deeper and deeper or apply more pressure, if you will, as you continue to work through it, but you do not want to bruise. There are some practices out there where you do see bruising from this type of work, this type of treatment, but for me personally, I don't think that that's very necessary for most people, and it's definitely probably not going to be necessary for you to do at home on yourself or on your spouse or anybody at your house, especially since you all are not trained professionals. Probably I am, and even me, I don't go to the point where I'm bruising somebody. Once you start to see any red spots come up from scraping, that means you need to back off a little bit or just go to a different area for a little while, and then you can kind of go back to that spot again. This isn't going to probably fix you 100% by any means, but it hopefully should get you a little bit more range of motion and a little bit more pain relief. So if you guys have any questions, comments, or concerns, just let me know. All right.